Welcome to today's eye health focus, conjunctivochalasis. This condition, often overlooked, can significantly impact your comfort and vision. We'll explore what it is, what causes it, how it's diagnosed, and what you can do about it. Let's dive in. So, what causes conjunctivochalasis? The etiology is multifactorial, meaning there are several contributing factors. Age is a significant player as the conjunctiva naturally loses elasticity over time. Chronic inflammation, perhaps from dry eye or allergies, can also weaken the conjunctival tissue. Exposure to ultraviolet radiation and environmental irritants contribute to the breakdown of the supporting structures. Lastly, some studies suggest a link to underlying systemic conditions, although more research is needed in this area. To understand conjunctivochalasis, we need to look at the pathophysiology. Essentially, the conjunctiva, the clear membrane covering the white part of your eye, becomes loose and redundant. This excess tissue can fold upon itself, especially along the lower eyelid margin. This folding disrupts the tear film, leading to dryness and irritation. It also creates a space where inflammatory mediators can accumulate, exacerbating the problem. Think of it like a wrinkled piece of fabric that no longer lies smoothly. That's similar to what happens to the conjunctiva. While precise epidemiological data is still being gathered, conjunctivochalasis is thought to be relatively common, particularly in older adults. Studies suggest prevalence increases with age, affecting a substantial portion of the population over 60. It's also often underdiagnosed as its symptoms mimic other ocular surface diseases like dry eye. Therefore, the true prevalence is likely higher than currently reported. The signs and symptoms of conjunctivochalasis can vary from mild to quite bothersome. Common complaints include persistent eye irritation or grittiness, a feeling like something is constantly in your eye, foreign body sensation, excessive tearing paradoxically, as the tear film is disrupted, redness of the eye, blurred vision, especially fluctuating vision, and in severe cases, the folded conjunctiva can even interfere with eyelid closure. These symptoms are often exacerbated by blinking or eye movements. Diagnosing conjunctivochalasis usually involves a thorough eye examination by an eye care professional. They'll assess your symptoms and carefully examine the conjunctiva, particularly looking for folds and looseness. Vital staining techniques, like fluorescein staining, can help visualize the disrupted tear film and any areas of inflammation. In some cases, photographs or videos may be taken to document the condition's severity and monitor its progression. Specialized instruments like slit lamps allow the ophthalmologist to carefully assess the conjunctiva and tear film. While there isn't a universally accepted classification system, conjunctivochalasis can be categorized based on severity. Mild cases might involve minimal conjunctival folds and only occasional symptoms. Moderate cases have more pronounced folds and more frequent, bothersome symptoms. Severe cases feature significant conjunctival redundancy that visibly interferes with vision or eyelid closure and causes persistent discomfort. This classification helps guide treatment decisions. Treatment for conjunctivochalasis depends on the severity of the symptoms. Mild cases may be managed with conservative measures, such as artificial tears to lubricate the eye, topical anti-inflammatory medications to reduce inflammation, and improved eyelid hygiene. More severe cases might require surgical intervention. Surgical options include conjunctival resection, where the excess tissue is removed, or procedures to smooth and tighten the conjunctiva, such as thermal cautery or amniotic membrane transplantation. The goal of treatment is to restore a smooth ocular surface, improve tear film stability, and alleviate symptoms. While completely preventing conjunctivochalasis may not be possible, several measures can help minimize your risk or slow its progression. Protecting your eyes from excessive sun exposure by wearing sunglasses. Managing underlying conditions like dry eye or allergies. Avoiding environmental irritants, such as smoke or dust. Maintaining good overall health with a balanced diet and adequate hydration. Regular eye exams are also crucial for early detection and management. The prognosis for conjunctivochalasis is generally good, especially with appropriate treatment. Most patients experience significant symptom relief with either conservative measures or surgical intervention. However, recurrence is possible, particularly if underlying contributing factors aren't addressed. Ongoing research focuses on developing new and less invasive surgical techniques, as well as identifying potential genetic or molecular markers for the condition. Advances in tear film analysis are also helping us better understand the pathophysiology of conjunctivochalasis and develop more targeted treatments. Stay tuned for more updates as research progresses.